yeah, thank you to everybody for coming today to the Nursing AGM. So we will do the official nominations at the end of the session, but we thought we'd take this opportunity, being a specialist nursing group, to tell you all about the Welsh Nursing Care Record, as they were the winners this year, and it's nothing to do with me, of the BCS Best Healthcare Project in 2021. So my name's Fran Beadle. I am the Chief Nursing Information Officer at Digital Health and Care Wales, but I am also the current chair of the BCS Nursing Specialist Group. So in Wales, why did we think that we should digitise nursing documentation? So everything was paper. There was no digital applications to support that. And living in the 21st century, there was a real lack of standardisation across Wales. When I went to Wales, I went the length and breadth of Wales, and there were differences from ward to ward, as well as hospital to hospital and health board to health boards. So alongside our there were concerns from our chief nursing officer, from our directors of nursing, around the amount of lack of standardisation, but also all the manual auditing requirements that were required, because a lot of our patient care documentation, you'd have to search through files. And I remember one director of nursing saying to me that if they were doing a review of a patient file, maybe there's been an incident, that in some instances they would have to print that file off 7 times. So actually, how could we simplify but ensure that we reduce the amount of duplication of documentation, to ensure that our documentation was following our patient as opposed to the health board or to the health professional? And, you know, talking to nurses out there, there was a lot of duplication because the documents were held in different places. But also alongside that, the nurses out there felt there was a lot of repetitive questioning. And of course, our patients believe that we are one NHS and that our information follows with us from our GP record through to inpatient care and tertiary care.D as we know, that wasn't the case. So what we identified was that there was a real need to standardise and digitise nursing documentation across Wales to improve the nursing and patient experience. So, as I said, you know, social media and banking, online banking, has been the mainstay of our world now. But actually, health was quite slow to uptake onto that, and so this initiative has very much been driven by nurses for nurses to improve patient outcomes, and patients have always been at the heart of the journey that we've been on. And what we saw, that technology had to be the enabler to allow for that culture change. As we move into a digital world in health, you know, we all online shop, we all online bank, or the majority of us. And I think if anything has come out of COVID, anything good has come out of COVID, is that people now see technology and are not so scared of it. And that's been part of our ethos moving forward. It had to be simple to use, because I think you'll hear colleagues and nursing midwifery colleagues say, you know, technology in the past has been done to us, but actually with this program of work, it's very much been driven by nurses, for nurses. So who did we involve in our program of work? So it was a very collaborative project. It wasn't just nurses. We had links in with our developers, our technical architects, medical directors, information, patients, testers. We needed to make sure, to enable this to work, that we got sought advice where we needed to seek advice. And like you say, you know, ultimately we're nurses at the heart of this. I may be a clinical informaticist, but I'm not technical by any way, shape or form. But how could we support each other to bring out the best outcome for our patients and staff across Wales, and make that information, the ethos was document it once and reuse many times. We very much have in Wales an ethos of a once for Wales, and we needed to, and we wanted to follow that mantra to ensure that information flowed with the patient, not with the professional. And now the screen won't move. Okay, so our vision was that we wanted to make sure that the Welsh Nursing Care Record was easy to use and that staff were competent to use the Welsh Nursing Care Record, known as WNCR, across Wales, and that we utilise all the data that we're capturing to improve outcomes and experiences, not only for our patients, but for our staff also. You know, there are worldwide shortages at the moment of nurses across Wales, so anywhere across the UK, and we're using a lot of agency staff, and plus our students all across health board boundaries. So we wanted to make sure that it was seamless for them, and that we weren't creating more work for staff, but less work for staff. And alongside that was bringing everybody along with our vision at the same time. And as our previous Director General, Dr. Angel Goodall, said, he wants staff and patients to move across health boards and boundaries with standardised and digitised patient records in line with our single patient record across Wales. So our vision was that we'd have one patient, one nurse, and one nursing language. And the outcome of that was, the aim would be, and the benefits of that would be to have safer patient care. So we needed to make sure that that was the vision that everybody were working towards. And how we demonstrated that was by having a governance structure to support that. So we had a governance structure that provided assurance to our Welsh Government, to the Welsh Clinical Informatics Council, which is a group of clinical informatics specialists from all of the multidisciplinary teams. So although this was for nursing, this is very much about information for the whole of health, to make sure that this information flowed freely to where it was required, so that professionals could access where needed to have the right information at the right time to give the right care. So we split it into 3 workshops. We have an SRO who is Claire Bevan, who was at the time a director of nursing. So we needed this to be led from the executive level alongside with the different work streams, because like I say, I'm not technical. We needed our technical colleagues to advise us to do the right thing alongside our information teams and our clinical teams. So we're split into 3 different areas. One is new documents work stream, which I chair, and our technical colleagues are led by one of the health board leads, and how to inform us and develop what was the best way moving forward to make information move, but also from a point of view of the system, that it was simplistic to use. And we actually built off of a system that was developed in one of the health boards. It's now the national system, because we had a finite amount of funding to be able to support that. And then where we are currently is around implementation, which is chaired by Leslie Jones, who was going to give this session, but unfortunately couldn't do this session day. So alongside all of these work streams report back up to our project board and out to our various areas such as Welsh Government. And we're funded through digital priorities funding as a new project. And obviously as we move to business as usual and informing that business as usual, that will be funded from the national organisations alongside the health boards. So we have a change advisory board, we have clinical input sessions, develop and design alongside our national project team and service management board. Now, all of this is underpinned by, we have created new positions across Wales for nursing, in that we now have, where we are now, we now have a Chief Nursing Information Officer in every health board and trust in Wales, alongside a clinical nurse specialist, because one of the key pieces of advice that we gave to our directors was that, it's all very well developing a digital system that nurses love and want to use, but you need the resources and the business change elements to that to support the implementation across Wales. So like I said, I lead the information standards workstream, and how we came to our standardisation was we would go out to our specialist multidisciplinary groups. So that could be tissue viability. For falls, it was our directors of therapies, falls forums, dietetics forums, to ask them to review the best evidence and the current evidence, and to come back with a recommendation that then went through health board approvals. And in some instances, there were the creation of new documents groups to ensure that everybody within health boards not only approved the recommendation, but were also part of sending recommendations back to the national team. And ultimately what that came up to then is, once that recommendation was approved by every health board, it was then directed back up through the directors of nursing midwifery, who approved the recommendation. We actually also challenged them on the journey, because there was, for one instance, that the new tissue viability screening tool was pressure damage risk assessment. 7 health boards agreed, but 1 didn't. So actually the nurse directors, ultimately the decision lay with them on what they thought was the best way to go forward. Was it that they wanted standardized risk assessments, or did they want that there were 2 types of risk assessments? But ultimately they agreed that we wanted one. And then the chief nursing officer then finally issued a Welsh health circular requesting that all health boards use the new risk assessment tools and the new adult inpatient assessment. So as you can see, this picture just demonstrates, previously there were lots of paper, but actually this is our new filing cabinet. You know, there are, I think anybody who's a nurse on this presentation will understand that there are filing cabinets full of paper documentations, and actually now all of that is held within a device. You know, we listen to our staff, what devices they wanted to use, what priorities they wanted to use, you know, alongside the standardization, definitely. You know, there was also the question, do we still need to use these forms? Are we just using them historically? So it wasn't just about transforming that paper document into a digital document. It was about looking at, do we really need it? Was it the best way forward? And listening to our technical colleagues and how we could utilize and develop something that was simple and easy to use. So some of our, this is just, I'm not going to go through every one, but these are phase 1 documents, and we're already moving forward with our phase 2 documents, looking at some of the new forms that we're developing. And one of the key documents on phase 2 is care plans. And across, when we were looking across, there's ultimately hundreds of care plan documents, and we've really re-looked at the model of why we were doing that, and working with our government colleagues, our nursing colleagues, and our specialist colleagues across Wales about how we could utilise the information from our assessments to inform our care plans, which at the moment are standalone. But actually, how could we do that in a way that we reuse the information that we captured on our assessments? And you'll see on the phase 1 documents, all our assessments have timeframes underneath them. And since implementation, we have absolutely seen an improvement of risk assessment with patients, especially with pain. It's really demonstrated benefits to our patients. Their pain is being assessed and treated appropriately. So our standardization will be ongoing until such time as potentially there are no more forms to write on paper. So this is our user experience. So we've been live with the Welsh Nursing Care Record now for 13 months. You know, I don't think any of us really realized the success that it was going to be. Of course, there are people out there who struggle with the technology, and that was really crucial to our implementation, has been our business change team, who've been out there on the ground with our staff. You know, in the very beginning, we asked staff how they felt, what support they would need for the implementation of the Welsh Nursing Care Record. And we listened to what they told us. They told us it wasn't about taking them out into a classroom setting and training them how to use it. It was about being there during all shift hours to support them within the Welsh Nursing Care Record. And actually, we had one member of staff in one of the health boards who said, oh, it's time for me to retire. By the end of the week, they were like, oh, this is really easy to use. And I think that's really been the feedback from staff, is that it's been very, very easy to use. It's not difficult. It matches their workflow, and they could tell by the development of it that it was intended to do that. And so much so now, we cannot get new forms out quick enough for them to start using. So we've given them something and they want more. So where we are currently is, this is just an example of some of the data that we've got. So we're live at the moment in 6 health boards and trusts across Wales, which incorporates 109 wards across 26 hospital sites. We've got over 4,700 monthly users. And one of the key developments that we utilised during our phase was to enable our temporary staff to have access to our records as well. And it's really informed conversation. So currently we're working with our Health Education Improvement Wales at the moment and digital teams of how we give access for our student nurses into NHS systems across Wales from the beginning of their training to the end of their training. Because actually what this will enable is, we won't have to retrain people because they'll already be using the Welsh Nursing Care Record. So you save hours upon that, but actually we can teach our students to the risk assessments and the care planning that they're actually going to be using out there when they qualify as registered nurse. And you'll see here there's many documents created, and 22,500 documents up to April the 30th. But what's more significant is we have a Welsh clinical portal in Wales where all our documents go to once the patient is discharged. So you can see secondary care testing, you can see the GP record, and now you can see the nursing documentation, and the two will interact with each other. But 18% of our assessments have been viewed across health board boundaries. Now that's information that was never available to anybody before. We have a specialist cancer centre in Wales. So actually a high volume of those is looking at patients' data from other health boards that have been referred into them. So it's really demonstrating the true value of what this has brought to our patients and staff across Wales. So this is just pictures of people who enabled this to happen. And like I say, all of these people, we're not all nurses, we're our technical colleagues, our business change colleagues. We would never be where we are without all of these people. There are more people and change. And our team, when we first started this journey, there was myself, the SRO and the project manager, and that has just grown and grown and grown. And actually what it has enabled is new different career pathways for our nurses across Wales. And I can honestly say that I've seen a significant increase in the interest of staff coming into the informatics world across Wales. So this is just looking at our geographical area. We also cross boundaries into England as well. We've had examples of patients who've moved from our Haldar Health Board to our Swansea Bay Health Board. And actually the information that was being able to be provided before the patient actually arrives has been significant. You know, cardiac patients going to Swansea Bay from Haldar, but they've got access to the information before the patient arrives on the ward. So actually they can appropriately place them in the right place, but actually begin their treatment plan before the patient actually arrives. So our two biggest health boards, which is Anara and Bevan and Cardiff and Vale, they're beginning their implementations this year. And we're aiming to have the Welsh Nursing Care Record live across all health boards, all wards within the next 18 months. And in addition to that, although the standardisation in the first instance was about secondary care, we've standardised our nursing language for everywhere. So that's across mental health, district nursing, you know, that information then as we grow, and we in Wales are having a national data repository, will pass backwards and forwards through systems so that we have the right information for people at the right time. And our district nurses love the Welsh Nursing Care Record because they have access to information that they never had before. So these are just an example of the health boards that are live. And like I said, our Betsy Cadwaladr Health Board started in March, and Cardiff were started in March, but they're now starting in April. But as you can see, we've got one business change team that's 3 people who've assisted all of the health boards to do this, alongside the Chief Nursing Information Officer and the clinical nurse specialist roles that we now have in informatics. So what have our outcomes been? And I can safely say we've reduced our carbon emissions. You know, one key example was a palliative care nurse in Powys no longer had to drive miles to write in the chart to say where they've given advice for a patient. You know, the paper that we no longer have. We've improved patient safety. Our staff love it. Our students have access. Our temporary staff have access. And because we've done this across the whole of Wales, we've been able to work with our agency staff and their agencies to make sure that they have the information available to them. We've reduced the amount of duplication and unnecessary questioning. We've increased new position, and we've even, you know, like our multidisciplinary team are informing the record as well. We'd had health boards where the physio was writing in a separate set of notes. Now they're all writing in the same set of notes. So as we move forward, we're currently doing an evaluation with our university partners, with the University of Bangor. And actually now we've got more data coming to us. We're going to be working with our specialist teams to inform the future, to identify areas of good practice, but actually identify areas where there may be opportunities for research and providing data dashboards for people, so that, you know, we have a real time assurance for our directors of nursing, our chief nursing officers, but also informing our nurse staff, safe staffing programme across Wales, which is legislation in Wales. But actually stopping nurses having to, we can now audit, provide reassurance on every single patient rather than the select 20 that are captured from each ward. This is real-time data that's available to improve and showcase areas of really good practice, but also provide our staff with career pathways moving forward. And that has been demonstrated also by, you know, we had a COVID dashboard in Wales. We knew real-time data, and this supports the nursing and care record, supports our patient administration data, is real-time and up-to-date, and our patients are in the right bed at the right time on the digital solutions that we have.